The next one is non-communicating hydrocephalus. Non-communicating hydrocephalus is a condition that results when the ventricular system does not communicate with the arachnoid villi due to some obstructions in the normal pathways of CSF flow. Consequently, CSF is produced in the ventricular system but cannot flow to the arachnoid villi to be reabsorbed. Such obstruction can occur when pathways are blocked by a tumor, congenital abnormalities of the brain, cyst, inflammation from infection, or any other condition that interferes with the potency of these pathways. Etiology of hydrocephalus: congenital intrauterine infections, mainly rubella, toxoplasmosis, cytomegalovirus, congenital brain tumor, intracranial hemorrhage, congenital malformation of arachnoid villi, acquired inflammation, trauma, neoplasm space occupying lesion like tuberculoma, subdural hematoma or abscess, glymus, ependyoma, astrocytoma, choroid plexus, papilloma, pseudomotor cerebri, chemical hypervitaminosis A, connective tissue disorder, Hurler syndrome, achondroplasia, degenerative atrophy of brain, arteriovenous malformations, ruptured aneurysm, cavernous sinus thrombosis. This is a picture. A baby suffered from hydrocephalus, scene in which a biggest head Hurler syndrome, achondroplasia, degenerative atrophy of brain, arteriovenous malformation, ruptured aneurysm, cavernous sinus thrombosis. Clinical features: large head, soft spot, prominent veins over the head, measurement of the head at the largest part, bulging of the eyes with downward gaze. Clinical manifestations: an unusually large head, a rapid increase in the size of the head, a bulging or tan soft spot fontanelle on the top of the head, massive sign, eyes fixed downward, sunsetting of the eyes, shiny scalp with prominent scalp vein, poor feeding, seizures, deficits in muscle tone and strength, responsiveness to touch and expected growth, vomiting, sleepiness, irritability. Diagnostic evaluation: physical examination, positive transillumination of infant head, typical cracked pot sound, mass vein sign of the skull bone, ophthalmoscopy, MRI, CT scan, cranial ultrasonography and X-rays. Lumbar puncture: insertion of spinal needle into the subarachnoid space between the lower lumbar vertebra. Cerebral spinal fluid: normal CSF, abnormal CSF, clear odorless white WBC 0 to 5, protein 15 to 45, glucose 15 to 80, pressure जो है 50 to 180.